In this Coolsculpting procedure training video, we will discuss how to use the CoolFit applicator on the upper arm. Topics include how to assess the arm, plan the treatment with markings, place the applicator, and position the patient. It is important to understand the anatomy of the arm to help plan the treatment protocol. The ulnar nerve is one of three main nerves in the arm. It travels from the neck down into the hand and can be constricted in several places along the way. The radial nerve runs down the underside of the arm and controls movement of the triceps. It is also responsible for extending the wrist and fingers and controls sensations in the hand. If pinching or prolonged constriction occurs to either the ulnar or radial nerves, it may cause temporary numbness, pain, and in rare cases, motor function alteration in the elbow, wrist, hand, or fingers, lasting a few hours to days after treatment. In very rare cases, these side effects have taken months to resolve. Follow the treatment protocol to avoid constriction of the ulnar and radial nerve. For the right candidate, the CoolFit applicator can be used to contour and slim the arm. During treatment, the CoolFit vacuum applicator will draw tissue between two cold plates and deliver uniform cooling to the treatment area. For consistent, aesthetically pleasing outcomes, patient selection and the assessment process are essential. Ideal candidates for Coolsculpting treatment on the arm have a distinct bulge or pocket of fat. The goal of treatment is to minimize the appearance of that bulge. Avoid treating patients with skin laxity or fat that extends over the elbow. Patients who do not have a bulge are not ideal candidates for treatment. The Coolsculpting procedure should not be used to improve the quality of skin or improve laxity. Talk to the patient about their expectations for treatment. Here are some of the outcomes you can expect when following the recommended treatment protocols. Before the patient arrives, prepare the treatment room. Clean the marking pen and applicator planning template with alcohol. Attach the CoolFit applicator into the system and the purple cycle card into the applicator. Insert the purple liner into the applicator cup. Turn on the system and ensure that both the applicator and card have been authenticated. Use a protective cover to keep the treatment bed clean. On treatment day, the patient should wear a sports bra or tank top. Document their weight on the treatment planning form. When taking baseline photos, consider capturing two arm positions. In the first, ask the patient to extend their arms with palms facing down. On the second, raise the arms to a 90-degree angle with their palms relaxed. During the assessment, ask the patient to stand with their weight evenly distributed. With their arm relaxed at their side, confirm that excess tissue is not draping over their elbow. The CoolFit applicator cannot be placed on the elbow. If excess tissue is visible over the elbow, the patient is not an ideal candidate for treatment on the arm. Ask the patient to extend their arm out and bend upright at the elbow so their palm is facing their shoulder and their hand is relaxed. Sit at eye level to the treatment area and visually confirm that a bulge is present. Gently pinch to assess the amount of fat tissue versus skin that will be drawn into the applicator cup. Before marking the patient, wipe the treatment area with alcohol to remove excess oil or lotion from the skin. Identify how the bulge naturally presents on the arm and mark where it tapers on both sides. Align the cooling panel on the applicator planning template to the markings. The cooling panels on the template should meet where the treatment tapers on either side. Favor placement laterally to avoid the ulnar and radial nerves. Draw a line from one end of the template to the other. Mark the end of the template to help position the applicator at the correct angle. Remove the template and extend the cooling panel lines. While the patient is standing, gently drape the gel pad starting at the anterior arm and smooth the gel pad posterior, eliminating wrinkles and air bubbles. Engage the vacuum and apply the applicator straight on following the treatment markings. Verify that the gel pad is extended past the applicator's cooling panels and check to see if there is sufficient contact with the cooling panels. Stop the treatment if the patient experiences numbness, tingling, changes in motor function, or any circulatory compromise in their hands or fingers. Remove the applicator, replace the gel pad, and repeat the applicator placement process, favoring a more lateral placement. Discontinue the treatment if these sensations worsen or persist on the second placement. To deliver therapeutic cold to the treatment area, tissue must make contact with the cooling panels. A good vacuum draw will allow maximum tissue exposure to the cooling panels and greater opportunity for fat cell death. After placement of the applicator, help the patient into a seated, reclined position on the treatment bed. Secure the applicator in the support arm. Use pillows to support the applicator and improve the comfort of the patient. Position the arm in downward direction, ensuring circulation to the distal extremities, and cover the patient with a blanket or sheet. After the patient is in position, engage cooling. Common side effects include an intense cold, tingling, stinging, aching, and cramping as the cooling begins. These sensations generally subside as the area becomes numb. The patient should be relaxed without arm movement during treatment to ensure that no new tissue is being introduced into the applicator cup. Return to the room before the treatment ends and talk to the patient about what to expect during the applicator removal process. Turn off the vacuum immediately after cooling has ended. Release the vacuum seal by sliding your finger between the patient's skin and the edges of the applicator cup. Remove the single-use gel pad and begin to administer a 2-minute post-treatment massage. Begin the post-treatment massage immediately after the treatment ends to manipulate the fat cells when they are at their most crystallized state. In the first minute, vigorously knead the treatment area. In the second minute, apply a deep pressure massage in a circular motion. The same person should administer the massage on both sides for consistency. Educate patients on what to expect after treatment. In the days and weeks following treatment, the patient may experience redness, bruising, swelling, tenderness, cramping, and aching. Sensations of itching, skin sensitivity, or numbness can last several weeks after treatment. These sensations are normal, but instruct them to contact you if they worsen over time. Patients may begin to see results in as early as 3 weeks, but will experience the most dramatic results between 1 and 3 months. Bring the patient back after 30 days for a follow-up medical assessment to review results, reassess, and determine if additional treatments are needed. Treatment of the arm may take more than one treatment session, so set expectations with your patient during the consultation. With a variety of applicators, the Coolsculpting system allows you to create customized treatment plans to fit the individual needs of your patients. The CoolFit applicator is preferred for treatment of the arm. For ideal patient outcomes, determine if the patient is an appropriate candidate for treatment. Identify and mark where the bulge tapers on both sides. Use the CoolFit applicator planning template to mark the treatment area. Ensure the cooling panels meet where the tissue begins and ends. Apply the single-use gel pad. Engage the vacuum and apply the applicator following the treatment markings. Seat the patient in a reclined position with their arms positioned downward. Initiate cooling only after the patient is comfortable. Immediately after cooling has ended, administer a 2-minute manual massage. To make the Coolsculpting procedure successful in your practice, properly educate patients on what they can expect during and after treatment. Deliver transformational results by performing a 360-degree assessment and developing a customized treatment plan. Provide the patient with a positive experience by creating a relaxed and welcoming environment. Thank you for partnering with us. We look forward to helping you make the Coolsculpting procedure a success in your practice. Results and patient experiences may vary. The use of this device on areas with superficially located nerve branches, arteries, or veins has not been demonstrated to be safe and effective. Such use may result in injury to the patient. During the procedure, the patient may experience deep pulling, tugging, pinching, numbness, or discomfort. Following the procedure, typical side effects include temporary numbness, redness, swelling, bruising, firmness, tingling, stinging, and pain. Rare side effects may also occur. The Coolsculpting procedure is not for everyone. Patients should not have the Coolsculpting procedure if they suffer from cryoglobulinemia or paroxysmal cold hemoglobinuria. The Coolsculpting procedure is not a treatment for obesity. As with any medical procedure, a consultation should be done by a licensed physician to determine if the patient is a candidate for treatment. Consult the Coolsculpting System User Manual for a complete list of contraindications and potential side effects. Treatment applications that deviate from the guidelines are not recommended.